The BUMP program came from our aged care wards, where we noticed that there was a group of patients who were suffering changed behaviours because of their dementia and other medical conditions they had. This was creating a space where we needed to look at the safety for both the staff and also for looking at how we managed to care for those patients and their families. So to create and plan the BUMP program, we met with many of the key stakeholders, including consumers, medical, allied health, to discuss how we would develop this patient-centred program.
So the whole team work collaboratively. We have an occupational therapist, a diversional therapist, nurses, social worker, allied health assistants and clinical psychologists. Together we overlap in our work, however we work collaboratively to be able to provide the best patient-centred care that patient needs at the time.
The BUMP team, with the support from the multidisciplinary team, have been able to settle patients into their new homes and successfully discharge from hospital. This has been achieved through therapeutic activities such as games, reminiscing, joking and tasks of daily living. We have been able to do this through understanding patients' personal preferences. A win for us has been where the patient enjoyed the outdoors, and we were able to facilitate access to our sensory garden where the patient did some planting of vegetables and weeding. In return, this improved patients' behaviours and patient was successfully discharged to the community. In recent times, patient has visited us to thank all the staff who were involved in his care, and we are glad to see that the patient is thriving in the community.
Here on BUMP, we constantly seek feedback from patients and their families. Just recently we had a family member say to us they knew their dad would be a challenge. But with the time spent with BUMP, he was able to become less distressed and more supported within the hospital. Hospital is usually distressing for him, but he was much more comfortable, and we value that.
Staff have fed back to us that they feel safer coming into work when the BUMP team is present. They appreciate the support and education we provide. It has been great to hear how much the staff and patient appreciate this unique program.
This is the first allied health-led program that focuses on managing changed and challenging behaviours within an acute hospital setting. The team is here 7 days a week, providing support for patients, staff and their families. We provide an intensive intervention and de-escalation service to increase everyone's safety.